Vic, be honest. Do I look like a woman who's finally found the fountain of youth? Or like a complete sucker who just blew $500 on a red light bulb?
You look like a normal woman who doesn't want to age. But if you use the lamp exactly the way Instagram morning routine videos show it, you'll likely get no real results. Red light only works if you get 3 things right: power, distance, and timing.
Hey everyone, I'm Emina, and let's be honest, I don't want to get old. Online, red light is supposed to fix everything. Wrinkles, joints, depression, you name it. And like a lot of us, I've fallen for marketing hype more than once. Eternal youth, 20% off. I'm done buying promises without clear explanations. So, Vic, walk me through it, but please, no vague science talk and no drowning me in percentages. What's the real story?
I can't do it with 0 numbers, because that's exactly how people get misled. But I'll keep it practical. Let's start with skin. I have clinical studies where results were measured objectively, ultrasound, and in some cases, even biopsies. And there are also hard stop situations, cases where you absolutely shouldn't use it.
Whoa, slow down. You're already jumping to warnings. Let's start simple. I grew up on a farm. When chicks hatched, we'd put them in a box with a red painted bulb. That's basically the same thing, right?
I doubt anyone did a clinical trial on barn chicks and painted bulbs in a way that matters to humans. But no, if you just paint a regular bulb red, it won't give you the effect people mean by red light therapy.
Why not? Light is light, isn't it?
Picture your cell like a TV. You want to change the channel, but you need a remote that's actually matched to that TV. You can shine a flashlight at it all day. Nothing happens. Wrong signal. But with the right remote, it works. Light is similar. It's not just about brightness, it's the wavelength. Cells only respond to specific ranges. If you hit those ranges, you can get a real biological effect. If it's just random light, nothing.
Okay, say I have the right gadget. I shine it on my wrinkles. So the creases are already there. I don't get how light is supposed to just smooth them out.
Let's simplify. Inside every cell, you've got little batteries called mitochondria. They generate the energy the cell needs to breathe and do its job. But thanks to stress, lack of sleep, sun exposure, nutrition, those batteries start fading. The cell goes into survival mode. It cuts anything non-essential. It's basically saying, sorry, no budget for repairs. It literally doesn't have the energy to fix the collagen network.
The collagen network?
That's what stops your face from sagging. Think of it like the springs in a mattress. When the springs are new, the mattress is firm. When they wear out, it gets soft and starts sagging. Those springs are your collagen.
So I'm aging not because of the years, but because my cells are just running on empty?
In a simplified sense, yes. A cell needs energy to live, repair itself, and make healthy copies. Less energy, fewer repairs. Studies suggest mitochondria absorb deep red light and produce more energy. With more energy available, the cell can increase production of collagen and elastin.
Collagen, we know that guy. But elastin, who's that?
Pull your skin and let go. See how it snaps back? That's elastin. It gives the bounce.
And if I'm low on elastin, things get loose?
And in studies, elastin levels increased by nearly 20%, around 19% on average.
19%? Sounds kind of weak.
It's not weak at all. Almost 1/5 can be noticeable in real life. Skin tends to bounce back faster. Fine lines can look softer. The face can look more firm. But it's not 10 years younger. It's about skin quality.
So where do you actually see the difference?
In wrinkle depth. Another study measured wrinkle depth with a profilometer.
A what?
A 3D skin scanner. It maps the skin surface and measures wrinkle depth objectively, not just before and after photos. Over 8 weeks, wrinkle depth around the eyes, crow's feet, dropped by 36%, roughly 1/3.
Now that's a number I can feel. So if collagen and elastin improve, does that mean I can hit the brakes on getting old?
Getting old is a huge topic. But improving the appearance and quality of skin, yes, that's realistic.
Dumb question maybe. Can you actually reverse it? Like, Rewind from 50 back to 30?
Not with a red lamp alone. At least, there aren't studies showing that. You can slow aspects of aging. And there are people spending millions on that, like Brian Johnson.
The guy swapping blood with his son?
Plasma, technically. But yeah, even he spends millions a year just to slow the clock. He claims some pretty dramatic improvements in his skin metrics. But that's a whole different world, and it costs a fortune.
So rejuvenation is possible.
Just not with a $500 lamp alone.
Got it. Okay, so I bought the lamp. What's the game plan?
You need a protocol. Power, duration, frequency.
Let's talk face. How do I use it?
For skin, you typically want deep red plus near infrared. Your panel outputs about 100 milliwatts per square centimeter. At that power, a common research-style approach is every other day, 15 to 20 minutes, from about 15 centimeters or 6 inches away.
Hold on, tell people how to find that irradiance number.
Check the manual. If it's a reputable brand, the number they claim is usually close to real.
And if it's a sketchy brand?
Check the hardware. Good devices use 5-watt dual-chip LEDs. If that rating is real, they get hot. So you need serious cooling. Heat sinks, vents, and fans you can hear.
How loud?
Like a desktop computer.
So, 5-watt chips and fans. Got it.
Not 5 watts, but each diode has a 5-watt output. For the face, you need 40 to 60 LEDs, each rated at 5 watts.
That sounds complicated. Is there a shortcut?
Weight and cooling. If a small panel has real heft, around 2 to 3 kilos, 5 to 6 pounds, it likely has serious heat sinks. Powerful LEDs make heat. That's physics.
Wearing a 6-pound mask on your face sounds ridiculous.
That's why most masks are low power, by design. They trade power for comfort.
Which means weak LEDs. So masks are kind of useless?
Not useless, just weak. You'd have to wear a low-power mask for an hour to get the same effect as 10 minutes with a panel.
What's the damage, price-wise?
Panels? Roughly $300 to $700. Professional ones go into the thousands. Yours is a solid choice.
Phew, at least I didn't get ripped off. Okay, you promised me the warning list. Give me the short list and I'll show the full list on screen.
Sure. You bought a pretty powerful device, close to medical-level irradiance, but it's sold in a regular store, so it needs to be used responsibly, ideally after speaking with a doctor. First, cancer, or any suspicious lumps or unexplained growths. Don't use it without medical approval. Second, fever, acute illness, high temperature, active inflammation, severe weakness. Not the time to experiment. Third, active bleeding or fresh injuries. Don't heat or stimulate the area until a doctor says it's okay. Fourth, medications. Some drugs increase light sensitivity and can cause irritation or burns even with normal use. If you take prescription meds, ask your doctor or pharmacist, does this cause photosensitivity and is light therapy safe for me? And finally, eyes, especially if you have serious eye conditions or recent eye surgery.
What about normal eyes?
Wear protective goggles and don't stare directly into the LEDs up close. Not even for a second.
All right, skin makes sense now. So what about the thing everyone's hyping, improving eyesight?